The Health Committee of the Ninth Assembly of the Federal Government of Nigeria have today visited the Lagos University Teaching Hospital on the completed project and the ongoing construction site in the teaching hospital. Based on the corporate provision of the 1999 Constitution, the House Committee on Health Institution is charged with the responsibility of exercising oversight rules over all the health institutions owned by the federal government of Nigeria, as the essentiality is to ensure that budget provision made for the institution are properly utilized. Requesting about the trust of the 2021 budget fund, it is said that it will improve the daily infrastructures and ensure adequate staff welfare and to equip the hospital with modern equipment to meet the teeming requirement of Lagos population. The chairman of the Ninth Assembly on Health, Pascal Chigozie Obi, at the press conference, held his opinion on the achievement of the hospital and also request the Chief Medical Director, Professor Chris Bode, to give an account of the funds being allocated to the institution.
Achieve this much because there are so many other CMDs in Nigeria. I don't think there is anyone that has achieved 10% of what we have achieved in terms of development partners. So I want to enjoin them to borrow leave from the Chief Medical Director, Lagos University Teaching Hospital, because government cannot do everything alone. Government has a lot of responsibilities that are quite enormous. When you look at what we have in Luth, then you now think about similar tertiary health institutions being funded by the same government. With that, you know that there is need for some people to come in, development partners to come in and contribute their quota.
The major factor in overhead is the fact that Luth is the only federal tertiary health institution with its own IPP, that's Independent Power Project, federally. It's costly. We pay 45 million naira every month, and we must pay by the end of the month. Otherwise, in fact, 2 weeks ago, was it last week, we were threatened with that they would shut down if we didn't pay, and we had to pay. We had to look for money. We've paid part of it. We need so power is the major consumer of our. So if we were spending 45 million naira a month, you can see how much we are spending in a year. That's about half a billion naira on power. But it has been of tremendous help. At least we are guaranteed 24/7 electricity. Many of our services run optimally. Our cancer center runs without any ease. Our X-ray center, the same thing. Our operations center can be planned. It's costly but effective. So it's something we will pray for you to help us intervene to increase our overhead.
Still speaking on the generation of funds, the Agege Federal Constituency of Lagos State, Dr. Samuel Babatunde Adejare, had his opinion as the Chief Medical Director, Professor Bode, lists some of the major challenges the institution is facing and the need for the federal government intervention.
At our level, we'll be looking at a way to throw up a bill to make sure that the corporate social responsibility of these organizations are really looked into, and they are tied to things like this, like how we are going to, improve on the medical services to our people. It's very essential.
Strike actions are causing instability in the system. They disrupt services, they disrupt projections, and they disrupt training and research. A lot of confidence that had been developed in us within the past 2 years have been lost, because even where we are working during this strike action, patients outside believe that you are on strike, so they don't come. The rapidly deteriorating value of the naira is also a cause of worry to us, because it has an ongoing deleterious effect on awarded contracts and budget projections. Virtually all ongoing projects are coming back to review the value of their contract. Some people actually who have not started say they won't, because the amount awarded could not take them home. All contractors have been asking for variations and reviews because of cost overruns. Third is the ongoing pandemic, which has more than halved our patronage and attendance in hospitals. It affects our revenue generation and projected expansions as well. And number four, emigration of medical staff. It has eroded our staff strength in all professional cadres. Doctors, nurses, pharmacists, and other professional staff have been resigning and leaving for greener pastures.
The Lagos State University Teaching Hospital Luth believes that if the federal government could support them fully, the hospital will go a long way in rendering healthcare service to the residents of Lagos State and Nigeria as a whole.